Hey everyone, welcome back. I'm here with a very special founder, Ira Sen Gupta, founder of so many things, including the cross-cultural healthcare program that we all know and love as our trainers in our initial training on this path of bridging the gap, as well as helping trainers to become trained to teach bridging the gap and getting that initial basic, much needed, still to this day needed in many places, but so happy to see in all 50 states the development and rollout of so many graduates of the program. So thank you so much for all of that. And we're going to rewind the tape a little bit, Ira, to get to what happened before that, because how did the NCIHC come together and how did you all find each other before the days of text messaging and emailing and having websites that you could visit, because that was just all starting to happen. So welcome to the Founders video portion of our archives here at the National Council. I'm really, really happy to sit and chat with you today, Ira.
Thank you so much, Ileana. It's a pleasure to be chatting with you. And of course, a real pleasure to be talking about what has moved us as a community of language access community, which has become so big, so refined, and so diverse. So it's just a great pleasure to be able to touch on all these points. And so thank you for asking the question about, what brought us to this and how did we become, this organization, and I mean, not just cross-cultural healthcare program, but National Council. How did we, where did we merge and what did we get? And so we were all, of course, very concerned in the country. Many experts like yourself and others who are on the board, it is a pleasure to see them, that they are still working so hard, for language access and equity and all the new things that have come in that have proved that they need to be incorporated in our work. So in those days, Ileana, we were all loners doing our best. And then we received a grant from Kellogg, which is Kellogg was the original grantor for the cross-cultural healthcare program. So Dr. Putch, who was one of the key founders of the cross-cultural healthcare program, as well as, I would say, a key founder of the National Council and very dedicated, he asked for more money from them and they gave us money. So he said, we need to bring these experts from all over the country together. And that's where we all came together in Seattle a couple of times. And suddenly we couldn't stop talking to each other, because so what do we do with the roles of the interpreter? What do we do about neutrality? What do we do about a code of ethics?
I can only imagine the energy in the room to finally meet like-minded professionals in the field. It must have been so energizing.
It was. We couldn't stop talking. This was a 2-day affair. We wanted to go on for wherever and ever, and we said, okay, we'll come together again. We'll go find some more money and see if we can come together again. So there were some, brilliant people in the room. And then we broke out and we did all these things, roles of the interpreter in one room. We discussed it. Nobody had come together to talk about it. So, we couldn't stop talking. And of course, there were variances in our opinions, which was wonderful. What do you do when we had interpreters in the room? We had the whole community. We did a community of folks who we later call the patriots of language access. And so that's how we all came together. And then it seemed fit to have a program, and we have an association, because we didn't, in those days. And we realized we needed a credibility in the world of language access and world of interpreting, the ATA, the Translators Association, was well on its way. They had all the rules of the game set up, the testing and all of that. And then I will say one person, one of the founders, Cindy Rhodes, she was there, totally dedicated, because I was a roommate, office mate of hers. She was on the phone, calling each of the folks that we had come together with, and working on saying, let's not lose touch. Where are we going to go next? So, so folks like Cindy never gave up. We all worked on this together as and you could call us founders for sure. And then Dr. Patch, he was just, Bob Patch was just amazing. And we needed the credibility in those days of a physician who's also speaking the same speak, because we had to, we had interpreters, they brought the stories of the patients, and then we had physicians and practicing physicians in practice, and also all professions, medical professionals. And he brought that credibility for us so he could talk about, in his clinic what he saw.
So you had all these people with a shared realization, because they work in the world of healthcare and see the additional challenges posed when there is a language barrier. But before you all came together, you were all individually trying to figure out how to navigate this challenge. So what was it? What were the things that happened to you, whether it was life experience or work experience, that propelled you on this path where you ultimately ended up coming together with other like-minded individuals? What were the things that got you started?
Yes, and I'm gonna describe a scene for you, okay? So here we are at the cross-cultural healthcare program at the PacMed buildings, on the 5th floor. We had the whole 5th floor that we could use. And we had these large tables, big conference tables, that they were like, okay, fine, you can use these tables, you can use the furniture. So we would sit around and bring our lunch to the table. So it was very organic and grassroots, and we would sit all together. We didn't miss a lunch, everyone. So we had interpreters, we had Bob, I was there, we had researchers that were part of CCHCP, we had librarians that had the medical library, and they were working on that. So we had a variety of folks, and different experiences. And we would sit there and we'd say, okay, what do we do with this? Here's an incident. Here's an incident. This is what happened at that clinic where people were denied access or they didn't understand. And here's a serious situation that happened because there was miscommunication. So for us individually, when we all came together, individual experiences were very important. So my life as an interpreter actually started in the legal arena. I was initially a immigration primary and secondary interpreter. And I was just talking about this, Ileana, yesterday at a gathering of the community. We were, again, lunching together. We like to eat lunch. So, but this was, the family environment. They asked me, like, how did you get into this? And so then I told them that my first awareness, Ileana, of inequities that leading from miscommunication and the disastrous results that people faced was in the immigration and secondary and primary and immigration system. And so I had no understanding of this. I was asked to just please, since you speak these languages, and I spoke Bengali, I speak Bengali, Nepali, and Hindi, the 3 languages from South Asia, of many other languages. Mm-hmm. Yeah, so then I was asked, I felt like it was my duty because I could speak this language to go, but little did I know what I was stepping into. And I was stepping into a very set system, immigration we all know, and a system which felt to me, and those days felt to me, like it was an entrapment system where folks who are coming without the right documentation, and I don't even want to say the right documentation word, who knows what it is? They're walking right into a very, very difficult situation. And so there I was interpreting, and then I realized how important it was to keep myself neutral. And all of these experiences, but yet I thought, the first day I said, I'm not going back. It's too, makes you heart sick, to see that immigration officer with the guns on his side and all the power in the world. And here's this young man cowing down, never realizing this is what was going to happen to him, that he would be sent back after he had given his life, his parents, family's life savings to a broker who said, all you have to do is go step off the airplane and you'll have a job. They have jobs everywhere. And don't worry about it. But here is this man, wearing a suit that was 2 sizes larger because somebody in the community just gave him that. And being measured on one instance, his height, because the doctored passport said he was 6 feet tall. And he wasn't, of course. So they were measuring him. So I was there, and it felt the indignity of it all, And I know there are laws, and I know that laws have to be followed. But this is not the first time immigrants are coming into the country. It's built on immigrants. But that's neither here nor there. So it was these examples where I was confronted with, and that's what I brought to the lunch table and said, this is what's happening. And I was on the board and of the cross-cultural, and then I took over as the executive director, and then became the main trainer and wrote all the curriculum with others at that time, because we thought, if we don't have a training program, Ileana, how will we train interpreters? And it was a lot about interpreter safety, Ileana. Because if they had guidelines, they had guardrails, it would be a joy to be able to interpret. And if they were taught and if they had support. So there was an association that was created that did their best to support. National Council has always been there. This is never went away. Went through the thick and thin of all the things that we have gone through, and came out with, of course, excellent programs. And we can talk about that later. So that was the start and the connection with the growth, with the creation and growth of National Council.
Well, that makes a lot of sense. And yes, immigration court is some of the most heartrending interpreting that I've ever done. And one of the reasons why I chose to stick with healthcare interpreting, because at least with healthcare interpreting, you feel like everyone is trying to help the individual move to a better place than where they currently are. And you definitely don't feel that in the legal setting, because it's an adversarial process. It's a war that's being fought. And I'm a pacifist. I want to help everybody. And that need is better met in healthcare interpreting. So hats off to you for sticking with that.
Yes, thank you. Thank you.
It takes a lot.
It takes a lot. And then I was interpreting the court system, because these folks were sent to detention, and then I was interpreting in a very hostile situation. So it was not, as you said, in healthcare, a win-win. The people they didn't have the same goals, but it was someone's going to win and someone's going to lose. And the people in power are going to define their reality, and they're going to win. And so trying to interpret in the court system was another very defining moment for me, interpret in the courts. Yeah. And so when I then got another call that said, Sherry Wilson from the health department called and said, she's no longer with us, but I need to mention her because she was a great advocate for this, and said, I hear that you speak Bengali and you speak. I said, yes, I do. And she said, well, we need somebody. There's a young woman who's about to give birth, and she really, we don't understand what she's saying, and we don't understand her husband. Well, can you come? And then the call was made. What do you say? No. What do you put things away and say, well, I have another thing to do? You go, you answer the call.
Right.
So there I was, and at Harbor View, and it was just another experience of a different kind. Because I said, yes, yet that power differential exists just as much. And with the lack of communication and understanding of what's happening to the patient and the family, how do we? I mean, it was in the incredible stories that took place where it really demanded a finesse. We had to, you interpret, but you don't get involved. And there was always this problem of how do I not get involved? How do I tell her, look, don't worry about it. Please, I know you're fasting for Ramadan, but this is a story, but the baby is not thriving because you're nursing the baby, and CPS is here and they're talking to the nurses. The nurses have called. They don't know who CPS, they don't know that the baby might be taken away. Those are the subtleties of the system if you don't know how it can. So I finally, I did the thing that we say don't do, but this was a critical moment. And I said, Afroza, you have to, of course, I use a different name for, HIPAA, but so I said, you have to eat. If you don't eat, then you're going to, and the baby will be taken away because the baby is not gaining weight, in fact, is lost. So once she understood, she didn't deny. She went home and she ate as fast as she could and as much as she could. The next time the baby was plumper, and I was relieved. So I thought, I think I went a little bit on the other side of the code of ethics that we talk about, but in this case, what do you do? So that kind of conflict exists because who is an interpreter, Ileana? In those days, you didn't make a lot of money being an interpreter. Did we do it for money? No, because the great satisfaction of being able to help with the communication was so satisfying that we went back to it, right, Ileana? We went back to it, all of us did.
Yeah.
And
it was such a reassurance for people who had started out when there were no guardrails, right? I started interpreting in Portuguese and Spanish in 1980, and HR gave us a list of employees that spoke another language. And I remember sitting down, there were 3 interpreters for the hospital, me and 2 other women, and the 3 of us discussing, we can't just accept this list. We're going to have to make time in our schedule and go and speak to each person. We divided the list in 3 and went around and spoke to everybody to just ask them, how well do you speak your language? Do you feel comfortable interpreting or talking about body parts? And a lot of people said, no, I really don't want to. They've asked me once before. It was the most horrible experience in my life. So we knew that person should not be on this list. but to have some of our small group conclusions borne out by the establishment of standards and code of ethics so that we could then point to something and say, look, it's not just our own common sense and work experience. This is what the National Council says. This is what Bridging the Gap trains. And then you have like a little book or something that you could pull out. It would help, because almost always back in the day, the people in charge of interpreting services were American born raised and had never traveled outside of the US and did not speak another language and were not familiar with any culture other than their own regional culture. And thank God for you guys for creating the references, the precedent, the
Yes.
codification of best practice so that we could do what felt much better than what human resources was telling us was
Yes.
okay to do. We did not want to use children
Yeah.
to
Yeah.
interpret because we had been the child interpreter for the family. It's like, no, you've got a real interpreter here. Let them do it. And you just hold your family members' hands. But to have the weight of
Yes.
an organization made up of the diverse language access professionals like yourself really did support us so well when there was nothing else to hold on to. So I do thank you.
Thank you. Thank you, Ileana. We did, and you know that. We just did what had to be done. Remember the pre-session? Ileana, the whole pre-session was amazing progress for us because,
Right.
you know, when I would teach folks, would say, you know, you got to do a pre-session. No, doctors and the nurses are too busy, which is true. They walk in, they're not even looking at you. And how am I going to do a pre-session? I said, that's when you establish yourself as a professional and say, I would have to do a pre-session as a trained interpreter. And they said, what pre-session? So then one of the participants, I'll never forget him, he, you know, it was a 5-day course. So then we would do it over a period of maybe 2 weeks. And he said, actually, I did it. Mrs. Sen Gupta, I did it. And I said, yeah, the best thing is, did you shake his hand and never let go?
Trapped.
You know, there's a thing like, you know, I'm going to think of. He said he was really impressed that I was professionally trained. And then he said he would see him that whole week. And, you know, whenever he would run into him, the healthcare provider would look at him and say, pre-session, pre-session. And so, you know,
And that's how we spread that message, right?
Spread that message that if you do the pre-session, you've set up those, you know, the parameters for.
So beyond the pre-session, what do you feel are some of the important strides or changes or developments that have taken place in the profession of healthcare interpreting?
Oh, huge. I mean, so it just makes me feel so happy, not only just happy, but so grateful, honestly. I mean, now National Council and others, what they've done is they've professionalized healthcare interpreting by training, certification. Let's not forget national certification, friends. You know, there was a lot of like, oh no, it's not gonna work. You know, recertification. I mean, the training piece was very big, and as we had mentioned earlier, is that training trainers to train the content, right? Not everyone could just do it. I mean, I'm sure that everyone was intelligent enough that they would, if they had the, you know, go, and I'm sure many did. But having a training program that is totally dedicated to training trainers, that was a big step in the right direction. But I would say national certification was one of the biggest steps to, I think, a great deal of satisfaction is that we can say now we are nationally certified. We have national certification. We have these programs for national certification, not one, but a couple. And then, you know, and the professional, I mean, the most important thing is we knew, right, Ileana, is that we have to make our profession, I mean, it has to be a profession, not just a fly-by-night kind of a, you know, thing that you do, but it's a profession, and there should be pride in the profession. And I feel like we have achieved that pride in the profession. As I was talking yesterday, suddenly kept on talking, and they're like, how'd you do it? How did you do it? You know, I mean, there were filmmakers in the room as friends. we were talking about this. And then as I animatedly told them about the situation of what happens if there's no language access. And you know how it started? And I'll just make a quick thing, is one of the young men in the room said, oh, big sister Ira, because, you know, we don't talk to older elders by their first name. So she,
Right.
big sister Ira. He said, I remember, do you remember when my mother came to, you know, first time to the US? I was late in going to pick her up. But anyway, he wouldn't have come in. But she was lost and she was in primary immigration. And you were there. And I said, yes, I remember. And we smiled. And even in being an interpreter at SeaTac, at the airport, it was full of bias. Because the person who hired me in Operation Welcome was a Swedish woman, very tall, blonde, very nice, beautiful. And she said, well, you know, at least you speak English properly. I said, yeah, actually I do. And then I said, actually, because I have a master's in English. Oh, all right, you pass. She said, but you can't wear those clothes. We have a uniform. I said, wonderful, what is your uniform? She said, we wear white shirts and I'll reissue these uniforms. I said, oh, even better. And she said, but we have skirts. You know, you have to wear a navy blue skirt. And I said, of course I'll wear a navy blue skirt. It'll just be longer than your other, than the mid-leg skirt. She said, what do you mean? I said, you'll see, it's even more modest. So longer. So then I came home and then I quickly went and got 6 yards of blue fabric that I could use as a sari. And I came back and I was wearing a sari.
With a white blouse?
A white blouse, you know, that she had issued. And she said, oh, I didn't understand. That's what you were talking about. I said, do you have any other objections to my uniform? She said, no, I guess it'll do. And then one of the other interpreters would tell me, you live here, you eat the food of this country. Why are you not wearing the clothes of this country? You know, and she was very upset. I said, okay, let me tell you something. How much of community service have you done? She said, what do you mean? I said, no, working in the community for free. How much have you done? She couldn't. At that time, I was a PTA president and I did all of this, you know. And so I said, so, you know, here I am. I love this country because it gives you the freedom to be who you are. Otherwise, I would live somewhere else. Don't you think that's true? She said, I guess. And I said, and you should come over to my house because you love the food I cook. There's no argument with food here. And for the last so many years that we've lived here, we've paid taxes better than anybody. So what else would you like me to do? She said, and nothing else. You talk too much. I said, well, that's a different story for another time. You know,
I think a lot of interpreters have been told in their life they talk too much.
So the path that interpreters, when they put themselves out in the public, that they feel, and they also feel a lot of pressure from the patient and the family who are like, oh, finally we found somebody who will take care of us, and you speak the language, and you're just like, you know, family. But then it's that thing, you know, we had to have the training to say, how do you stay calm? How do you stay polite? And how do you explain what the rules are of this? And when family members say, it's okay, you don't have to interpret, I'll interpret for her or him. Oh, that's it. You know, there's so many incidents like this, Ileana, that our lunch table, we brought to the lunch table. And many others.
Well, I have to thank you on behalf of all of the membership and on my own behalf, because full disclosure, folks, Ira was my Bridging the Gap trainer 25 years after my first staff interpreting job, but still, It's never too late. So all you interpreters out there who say, oh, I don't need that, I've been doing this for a long time. I learned so much, and I thank you, Ira, and I thank all the founders from the bottom of my heart for creating the pathway for all of these organizations to spring up. Look at how many regional interpreter organizations there are now that do such great work, as
Yes.
well as the national levels, the
Yes.
NCIHC, the IMIA, as well as CCHI for taking the lead in certification. But it all comes back to the beginning. So thank you so much. I'm not good at doing the heart thing. There we go. Thank you so much, Ira.
It's been an honor and an honor and an honor. Thank you, and a privilege. Thank you, Eliana.
Thank you so much, everyone.